Well, I think it's a great time to be a scientist, especially in the field of cardiovascular disease. Myself in particular, I'm a stroke neurologist who's interested in stroke prevention, as well as the interface between reducing ischemic vascular events and people who are prone to bleeding. And particularly now with the emergence of factor 11 inhibitors that may be able to reduce thrombosis without increasing the risk of bleeding, as well as some anti-inflammatory medications such as colchicine that could also do the same. I think it's really exciting new paradigm of medications that will be able to further reduce ischemic events without translating to a higher risk of bleeding. And this will be particularly important in older patients who have intrinsic small vessel disease of the brain that lead to hemorrhage, or those who have already had bleeding in the brain. And with advances in technology and pharmacotherapy and mechanical treatments, I think right now we're really at a kind of exponential increase in potential therapeutics that could help our patients. Definitely being a clinical investigator, a clinical scientist is challenging in terms of trying to balance work-life, priorities and demands. However, it is very, very worth it. And some advice is find a strong altruistic mentor. I would never be in the position that I am now presenting these results if it wasn't for very strong and kind and altruistic mentorship that I've had in my institution, such as people like Robert Hart, Mike Sharma, Stuart Connolly, as well as other very impactful people throughout my training. And if you happen to fail, try and try and try again. For instance, with grant writing, getting rejected is basically the rule initially, and you have to keep trying until you get your first grant. And then try to adapt to the strengths of your environment, right? You're going to be shifting from one institution to another from when you go from training to clinical practice, and sometimes the strengths there may not be what you're used to, but if you adapt to them, I think that's your greatest chance of success.